This video will be on pulmonary. So first off, chronic bronchitis is inflammation of the bronchial tubes leading to increase in mucus and chronic cough obstructing the airway. Emphysema is deterioration of the alveoli, which is air sacs in lungs, causing lower gas exchange and breathlessness. Asthma causes airways to become inflamed and constricted, leading to wheezing, chest tightness, and coughing at night and early in the morning. This is heterogeneous chronic inflammatory disorder, leading to episodes of bronchial hyperresponsiveness. Exercise-induced bronchial constriction. Use an inhaler before exercise testing. When having exacerbation of symptoms, wait till they reside to proceed with exercise. For COPD, which is chronic airway inflammation from noxious gases and particle exposure, you want to use the Borg category ratio. Exercise response to this improves lung function, decreases breathlessness, and increases overall fitness as long as you're using controlled breathing techniques, which is very important. Diagnostic testing with asthma, you can use a 6-minute walk test, which is walking as fast as possible. Breaths aloud, you want to measure the distance covered. You can use the incremental and endurance shuttle walk test, which is walking between 2 markers. Speed increases every minute until a patient can continue, just similar to the fitness gram pacer test. With COPD, you can use the 30-second chair stand test, which is just reps and sit to stand, how many you can do in 30 seconds, or you can use the timed up and go test, short but tough. You can use standing from chair, then walking a short distance, then returning to sitting, and then you record the time it takes to complete that. For lung training, you want to do daily. For lung function, this helps to minimize panic and anxiety from breathing restrictions. You can use the spirometry, records the amount and speed of air. The peak flow measurement records the maximum expiration speed of the air. And for exercise prescription, for higher intensity leads to greater physiologic effects. Lighter intensity is used for severe COPD or deconditioned patients. You want to hit aerobic 3 to 5 times a week, moderate to vigorous intensity, about a 4 to 6 on the Borg scale for the COPD. And this takes about 20 to 60 minutes. For resistance training, you want to do at least 2 days a week, not back to back, 60 to 70% of 1 rep max, 2 to 4 sets of 8 to 12 reps. And for flexibility, you want to do about 2 to 3 days a week to slight discomfort, hold for 10 to 30 seconds. And for asthma training, you want to make sure you're in a cold environment. And that is all for pulmonary.